this is Marika, and today we are here with another session on communication process. In our previous session, we have seen what is communication, what are the different types of communication, and we've also discussed what are the barriers that we face in communication. We have discussed barriers respectively in the field of nursing. As a nurse, what are the communication barriers that a nurse faces while communicating with the client, right? Today, we are here to discuss the most important topic, which everyone must be familiar with, is the method of overcoming those communication barrier. Okay? As we have seen, a communication barrier is anything that prevents us from receiving or understanding the message that is sent by a sender, right? So there are different types of barriers. We have seen stereotyping, rejecting the patient, and there are several other 8 types of barriers that we have seen. So let us see one by one what are the methods to overcome such barriers, okay? The first one is when you start communicating with a patient, when you, as a nurse, when you communicate with the patient, the first thing to look after is see if the patient has a hearing aid, okay? So when you communicate with the patient, you must make sure you know as a nurse whether the patient is using a hearing aid or not. Right? As we all know, communication is a two-way process. What message you are giving, what information you are giving to the client is heard by the client, and then the client gives a response, right? So you are the sender and the client is the receiver. So when you are communicating, and if the client has hearing aid, you must know that you must communicate loudly, right? You must amplify your voice when you communicate with patient if they have hearing aid. Sometimes if we don't know if the patient is using hearing aid or if the patient has hearing loss or some problem as such, we will not communicate loudly, right? So to avoid that, we must look, the first thing we must do is to look for hearing aid when you start communicating with a patient, okay? The next one is to amplify your voice if necessary. So when you're communicating with a patient, when you're communicating with someone, if necessary, you have to increase the volume. You have to speak louder, okay? The next one is before you start speaking to anyone, in general also, before we start speaking to anyone, we must know that they are listening to us, right? We must know that they are attentive towards us, right? Similarly, when you're communicating with a client, you must make sure that you have the client's attention. Okay. Also, when you are talking to the client, you must always make sure that you are facing them, right? You are sitting face to face with one another. Why? Because we've already discussed, right? Oral communication is the most effective form of communication because we face each other, right? We see each other directly. We communicate face to face, and not only just listening what a person speaks, we are able to observe the gesture of the person who's speaking, right? For that, you have to make sure that you have the attention of the client before you start speaking, and also you are facing the client while you're speaking with the client, okay? The next one is to structure the environment which is conducive to good communication, which means you have to make sure the environment that you are communicating with the client is quiet, right? You have to make sure that the environment is comfortable, okay? Now, the next one, when you communicate with someone, as I said, you have to have a very good environment, a comfortable environment. We have discussed this in terms of barriers also, right? So, when you communicate with someone, you need a comfortable environment, right? So, as much as you minimize the auditory or the visual distraction, it is good for communication process in general as well, right? When you communicate with someone, when there's too much loud noise, when there's too much distraction, you might not be able to give your message properly. So when you talk to the client, you should make sure that also the environment, the place you are communicating with the client must have adequate lighting. Okay, there should be good lighting, there should be good ventilation. Okay, the auditory and the visual distraction must be minimized so that you can communicate or you can give out your message effectively to the client. Okay. Next one, when you are communicating with the client may have some auditory problems, right? When you're communicating with an elderly patient, you must remember their deficit, which means you must remember that they might have less hearing power or they might have lost their hearing ability. Okay, you have to remember that the client may have problem with hearing, especially our elderly patients, right? They might have hearing problems, so we have to communicate with the client accordingly. Okay. Now, when you communicate with an elderly patient or when you communicate with a patient who has auditory problems, there may be communication breakdown in our communication process, isn't it? So you should not assume, as a nurse, you should not assume that this breakdown in the communication that is taking place is because the client is uncooperative. Usually, when we communicate with someone, even if I'm communicating with a friend, even if you are communicating with your friend, while you communicate, for example, when we are communicating with our friends, right? When we talk to our friends, sometimes when you are speaking something, your friend might not respond to you. It is our assumption that our friend might not be listening to us properly, right? Or they were not, paying attention to what we were speaking to, right? Here also, as a nurse, we might assume sometimes that the patient is being uncooperative or the patient does not want to communicate. That is why we are having this communication breakdown. But we should remember that the patient is an elderly person or the patient might have hearing disorders. So we have to remember what problems they are facing and then treat them accordingly and then communicate with them accordingly. Okay, the next one. So next is when we communicate with a healthy person. For example, if I'm communicating with my friend who's healthy, who does not have any kind of hearing problem. Okay, when we communicate with someone healthy, the person responds us, we respond properly, the person also respond properly to us, right? Because they are healthy, they are not suffering from any kind of problems, right? But here, as a nurse, you must remember that anyone you're speaking to inside the hospital setting, any patient, any client you are talking to is not a non-impaired person, okay? Which means the communication that we have with an impaired person and a non-impaired person is different. The impaired person, that means the person who's suffering from certain disorder, certain illness, might not respond to us properly because of their disorder. So as a nurse, we must remember that they are impaired. The client that we are dealing with on everyday basis are people who are suffering from certain disease. So as a nurse, what is our responsibility here? Our job is to facilitate clients' self-expression. Okay, the patient may not be able to communicate properly because of his illness, right? But as a nurse, it is our job, our responsibility to make sure we communicate with the client and we facilitate or we help the client to express himself or herself. Okay. Next one, when you're talking to the client, you must make sure that you speak slowly and clearly to the client. Okay. Also, when you're communicating with the client, you must maintain eye contact and use short sentences with simple languages, which is understandable by the client. Okay. Use of certain gesture through hands, using certain signs to communicate with the client so that it makes the client easier to understand what you are speaking. Okay. Once your conversation is over with the client, you have to make sure that you have summarized the important topics of your conversation, which means whatever important things that you have spoken to client, you have to repeat the sentences or you have to repeat the conversation, the important points that you have spoken with the client. Okay. Also, as a good nurse, you must give time to the client to ask and answer the questions. Okay, as a nurse, when you talk to the client, you must make sure that you have enough time to communicate with the client so that you give enough time, you give plenty of time to the patient, right? So that they can ask questions to you if they have any doubts, or to give answer, they might take a certain time. You have to make sure that you give that time required by the client to communicate. When you communicate with the client, you have to allow them to make errors. Okay, you have to allow them to make mistakes. Do not constantly correct them, even though while communicating they are making any kind of mistake or they are, the information that they are giving is wrong. You should not constantly correct them. For example, if you are given a topic for presentation, okay, you are supposed to present on a topic, maybe for example, Earth. So if you're communicating on that particular topic, if you're presenting on that particular topic, the person who's there to whom you're presenting is constantly correcting you and not letting you present the topic. Now, when someone constantly corrects you, you don't get the urge to speak anymore, right? You don't feel like speaking anymore or presenting anymore. Similarly, like that, when the client is communicating, when the client is giving certain information to you, if you constantly start correcting the client while they are speaking, the client will suppress his feeling to complete the conversation, which means the client might not feel like completing the entire conversation. So we have to allow the clients to make mistakes. Even if they are making mistakes, we have to allow them to make mistakes and we should not correct them constantly in between the conversation. As a nurse, we must be a good listener, but also as a nurse, we might have time limit for everything. We know we have less time, right? But still, in spite of having this difficulty to manage time, when you are listening to the client or when you are communicating with the client, you have to be a good listener. Okay? Now, why is it necessary to be a good listener? Now, when you're communicating with someone, obviously you want, as I have said earlier, again and again from the start of the communication chapter, we have been discussing that, when someone is listening to you properly, only then you will want to speak to those people, right? When they have your attention, before you start speaking, you need to have their attention, right? So when you communicate with the client, you must make sure that you give enough time for the conversation, because the client also feels respected. Okay, the clients also feel that the nurse is genuinely interested in his or her problem and wants to help him or her. Okay. The next one is to stick to one topic at a time when you're communicating with the patient. You have to stick to one particular topic at a time with the client. So when you're communicating about multiple topics at a time, it might confuse the patient, isn't it? When someone is talking to us as well, if they're talking about one single topic, if the conversation is about one single topic, it is easier for us to understand, right? Similarly here, for client also, if you take so many topics and talk about various things at a time, multiple things at a time, it might confuse the client might not understand what you are trying to say, because you are giving a lot of topic, a lot of things for the client to understand. So when you're communicating, you must only take one topic at one particular time and communicate accordingly. Okay. The last one is to have someone from the client's family or the caregiver with you while you communicate with the patient. Okay, if you have someone, a family member of the client, or if you have the caregiver of the client with you present when you are communicating with the client, the person, the family member or the caregiver will be familiar with the pattern of communication of the client, right? Because they have been with them for several years, right? Because they are family members, they know how the client communicates, what is the pattern of their communication. So when you have a family member or a client with you while you communicate with the patient, they will help you in the communication process. They will assist you in the communication process because they are familiar with the type of communication the client has, the pattern of communication of the client. Okay. So this was it for today's class. I'll see you all in the next session. Thank you.